this group is still going to be impacted if those numbers continue to climb.
Data showing children are bearing the brunt of COVID infections in Alberta, with young people under the age of 19 leading the way in cases per population. It has one Calgary doctor concerned about their long-term health.
The sad reality is that as we relax restrictions and almost having no restrictions in place at the end of the month, this group, especially that 0 to 12 group, is just being left vulnerable.
You can see here as COVID rates have dropped, they haven't dropped as dramatically for babies and children 0 to 4 or kids 5 to 19, who now have the highest COVID infection rate. Dr. Joe Vipond, a co-founder of Masks for Canada, points to several reasons why.
They're back in school, and we know that we really haven't upped in any way the protections that kids get in school.
And vaccinations. They're still not approved for kids under 12, and those in the 12 to 19 group are playing catch up as the last ones who were eligible. Vipond says this means children are relying on adults to behave appropriately to protect them.
Our kids don't have as much of a voice, and I think some of our public health leaders believe that because they are less likely to get severe illness and that the mortality is close to zero, that it's okay for COVID to just rip through this population.
But Vipond points to long COVID, kids who develop long-term disabilities after contracting the illness. While the full effects are still not known, studies out of the UK have suggested anywhere between 2 and 15% of kids have long-term symptoms. A small but not insignificant number, according to Vipond.
All of these factors suggest that kids, as they become the predominant carriers of the illness, are going to suffer.
Vipond has one message for Calgary City Council, which will debate Monday whether it will follow the province's lead and lift the mask mandate in a few weeks.
The simple act of wearing a mask protects our children who literally cannot get the vaccines that are protecting the rest of us.
His advice for parents is to keep up social distancing, gathering outside, and ensuring their child wears a mask that fits, or better yet, a respirator. Stephanie Lasuc, City News.